Good evening, everyone. Giving everyone a chance to get in and get settled here. We have quite a few people still joining, so give us a minute or two. Hi, everyone. As we're getting everyone in from the waiting room, if you want to all put in the chat, just let us know where you're joining us from tonight. That would be great. Rainy. Not often we see rainy and cold Los Angeles. Detroit, Tennessee, Georgia, Virginia. Oh, this is wonderful. People from all over.
I'm another Ottawa person. I'm also based in Ottawa.
Hey, we still got quite a few people coming in, so I'm going to give this another minute or two, make sure we get everyone in from the waiting room. If you're just joining us, thank you so much for joining us this evening. We're just getting everyone admitted from the waiting room, and we're asking everybody to put in chat where they're joining us from tonight. Well, it looks like we've got a wide range from all over the world, actually, which is fantastic. Excited to see where everyone's from. Okay. Looks like we've slowed down just a little bit. I'm sure we'll have more people joining us, and I'll make sure they get admitted from the waiting room as soon as they do. But I also want to make sure we have plenty of time for our session this evening. So my name is Gloria Bell. I am the founder of the Women in Tech Summit, and I want to thank all of you for joining us this evening for our virtual session. Rather than give you a great big introduction, I'm actually going to let Alana introduce herself. But I do want to just give everyone a heads up to be sure and watch your email after the event, because we will be sending out some information about our upcoming spring summit on May 2nd and 3rd in Philadelphia. And one of the things that will be in that email will be a 25% discount code. And one of the best parts about that discount code is it will also be good on our early bird discounted tickets. So you get double the discount. And the early bird discounts will expire on March 8th. So if you're thinking about coming, make sure you take advantage of the double discount there. So if anyone has any questions about the summit, don't want to take up the time this evening, you can visit womenintechsummit.com to get some more information, or you can feel free to email me at gloria@womenintechsummit.com. I'm happy to answer any questions and help you with that. But I want to give the whole evening to Alana because I know she's got some great information to share with you this evening. So I'm going to go ahead and go off camera, go on mute, and turn this over to Alana.
Okay, great. Thank you so much, Gloria, for that introduction. I'm going to share my screen now, and please let me know if you can see my presentation. correctly. Are you able
Yes.
to see the slides?
Yes.
Okay, awesome. So thank you so much, everyone, for joining on this Tuesday afternoon. Could be many things that you're doing, so I appreciate you coming to learn about how to break into the health tech space, how to break into the health informatics space. If you have any specific questions, you can leave them in the chat and I'll get to them at the end of the presentation. So in this webinar, I'm going to be giving an overview on some of the common skills used in the health informatics field, specifically in the role of the healthcare data analyst. I'm also going to be providing some tips on how one can prepare for applying for some of these jobs. And yeah, I left my email in the chat, so if you have any specific questions, you can also email me directly. So I'm just going to give a little bit of background about me. My academic background is in biomedical engineering. I did my undergraduate degree and master's degree in biomedical engineering with a focus on analyzing specifically maternal healthcare data to improve health outcomes. So I currently work in the health informatics space in Ontario, Canada. And during the pandemic, I began a podcast called the Health Analytic Insights Podcast. And that was because I wanted to, make connections with people. This is a very isolating time for most people. So I wanted to make connections with others, get to know people in the health informatics space. And also I remembered it was a real struggle for me to break into the field. So I started this podcast to meet other people who had broken into the field. And I was able to interview quite a few people who were both entry level, who had just started in the field recently, to those who were mid-level and senior level. And they provided me with a lot of tips. So I hope to bring that to you today in the form of this webinar, as well as my own advice breaking into the field. I also love all different types of fries. So I definitely try and work that into most of my presentations. So this is what we're going to cover in the workshop agenda. I'm going to give a brief overview of, generally what is health informatics. I'm going to talk about some of the common skills, give an example of a typical day in the life. What are some job roles that you can specifically search for in Indeed and LinkedIn today? And how can you increase your chances of getting a job as a healthcare data analyst? And these are questions that I didn't just pull out of the sky. These are questions that I've received across many different of the platforms that I run through my podcast and the YouTube channel. And I get these questions over and over again from individuals. So going straight into the definition of what is healthcare informatics, and this is sourced from the Healthcare Information and Management Systems Society. This is an organization that I would inquire you to research after the presentation because they have several different chapters throughout the States and Canada. And they basically allow you to volunteer in the health informatics field and learn more about it. They run several different events and networking opportunities. So I would definitely check out the Healthcare Information and Management Systems Society website. They define health informatics as the integration of healthcare sciences, computer science, information science, and cognitive science to assist in the management of healthcare information. For my own self, based on my own work experience, I would define health informatics as simply transforming raw and structured data into actionable information to improve clinical workflow and ultimately patient outcomes. So this is a quote that's often attributed to Peter Drucker: if you can't measure it, you can't manage it. Although it's a very simple quote, there's a lot of power in it. And we see that with healthcare organizations as they collect huge volumes of unstructured and structured data from medical images, lab results, administrative data, EHR records, and much more. And being able to make sense of this raw data and transform it into information for actionable results is a large part of the healthcare data analyst role. If we take a very basic example, and many of you might be able to relate when it comes to budgeting or even having a Fitbit tracker or keeping a food diary, being able to track personal metrics allows you to really make informed decisions. I know when I started keeping a food diary, it made me realize how many fries I was eating and consuming on a daily basis. And once I had this knowledge, I was able to, make a different decision if I desired. But human beings are notorious for over or underestimating situations, and being able to keep track of the different metrics that are important to you is key when it comes to making informed decisions. So here what you see in the slide is a picture of a dashboard, and this was developed by the Phoenix Children's Hospital. During the height of the pandemic, this is probably something that you can relate to in your region. Many hospitals paused elective surgeries, and this was the case at Phoenix Children's Hospital. And once the pandemic kind of slowed down around this area, the issue that they now had was, how do we resume the deferred surgeries in a timely and efficient manner? So to support this, they created this dashboard, which you see pictured here, to be able to have a technology or a tool which multiple surgeons could view and support how they would prioritize these deferred surgeries. So instead of having a disorganized system of emails, paper notes, and other files, the dashboard housed necessary centralized information where clinical staff could easily navigate and plan their schedule on a day-to-day basis. Specifically, the creation of this dashboard allowed surgeons to review cases and assign priority from high, medium, or low to both backlogged and new cases. Dr. Vadia, Chief Medical Information Officer at the Phoenix Children's Hospital, stated about the dashboard, the technology allowed for synergies across the enterprise in addressing the multifaceted challenges of resuming these operations. And here we see a prime example of how health analytics can make a significant difference in improving hospital operations and bringing different departments together within the organization. And this example does not exist in isolation. You can go on Google Scholar and search up the term clinical dashboards, and you'll see several cases of how healthcare organizations have used dashboards to aid improving patient care. So now going into some of the common skills that you'll see in a lot of these job postings for health informatics roles. So if you start to look at enough job descriptions, you'll see these patterns. And some of these key skills include relevant clinical degree or experience. This could mean either previously working as a nurse, pharmacy technician, a clinical research assistant, or at the help desk at a hospital. It could also be through a degree, obtaining your master's in health informatics or biomedical engineering or a similar degree. Public health is another example. You might also see these roles advertising for people who have experience with data visualization tools. And this can be something as standard as experience building charts or graphs in Excel to experience with more advanced tools such as Power BI or Tableau. If you're interested in learning data visualization, I would suggest downloading Power BI Desktop for free. And you can search for on Power BI website, Microsoft Learn, and it contains tons of free tutorials where you can beef up your data visualization skills. So even if you don't necessarily want to work in health informatics, but you're interested in the analytics space, this is a way to really improve your data visualization skills for free. One programming language that you might see advertised over and over again for the healthcare data analyst role is experience writing SQL queries. SQL stands for Structured Query Language, and this is a language that is used to interact with the data stored in databases. With the move to digitizing healthcare records, the amount of data that is stored and collected in healthcare organizations has exponentially grown. This is one of the reasons why a career in health informatics can be so exciting and fulfilling, because the problems are always changing. There's always problems. There's never a dull moment because you're always sorting through many different types of data problems and data types. You have to sort through types of data such as healthcare claims, blood work data from the lab, patient demographic information, and so on and so forth. And SQL is used to sort through tons of data and organize messy data into actionable information. And later on in the presentation, I will give a quick demo of how this can be done by writing SQL queries. Finally, a skill that is often requested in these job roles is strong communication skills. This is especially important in the health informatics field because you'll often be labeled as the analytical translator. This is a term that was coined from a McKinsey article, which describes the health informatics role to the T. So one day you might be meeting with clinicians who would like you to develop a program or report a dashboard, which helps them better track certain clinical metrics they might not be aware of. And then in another day, you might be meeting with IT or developers to actually take these clinical requirements and build out the technical solution. So you really have to exist in two different worlds, both in the clinical world and the technical world. So here I have an example of a potential use case that you might see as the healthcare data analyst. So imagine your boss wants you to create some analysis around identifying diabetic patients who are at risk of readmission back to hospital so that they can pass this information on to community nurses to follow up with these patients after they're discharged from care. And readmission rates back to hospital is a clinical metric that is often tracked by several different healthcare organizations because it can be a costly issue. So for example, in 2018, the Canadian Institute for Health Information estimated readmission to hospital costs more than $2.1 billion a year in Canada. And not only is it a costly issue for healthcare organizations, but it oftentimes can lead to negative adverse effects for patients. There has been research which has shown a reduction in patient readmission rates when there's a follow-up call from community nurses, and this could be as a result of increased medication adherence and also patients feeling more supported. So again, imagine your boss wants you to create a report which can determine which diabetic patients might be at risk for readmission back to hospital. So this information can then be flagged, passed on to community nurses who are carrying out the follow-ups with patients. So someone who is analytically minded might want to, immediately just dive into the data. But really the first step would be to have conversations with clinicians. You want to make sure that you're understanding the problem before you start doing any additional analysis. This could look like asking the community nurses, what are the key characteristics historically of individuals who are often readmitted back to hospital? Do they tend to be on several different types of medication? Is it age-related? And this is where your relevant clinical experience, which I was speaking about in the previous slide, can come in handy when it comes to help guide your questions that you're having with clinicians. So once you have the correct frame of reference, the next step would then be to sort through the data. So here I have an example of writing a SQL query. And basically, I'm using a fake data set that represents 10 years of clinical care at 130 US hospitals. And it's from the paper Impact of HbA1c Measurement on Hospital Readmission Rates. So here I have written some SQL queries, a select statement here, where I'm selecting information from the patient demographic table. And then I have another SQL query here where I'm selecting information from the patient diagnosis table. And SQL allows you to select information from several different tables in your database, and then also make joins. So you're connecting these two tables for holistic analysis. So I could join the patient demographic and the patient diagnosis table together through writing a SQL query. And that can allow me to do some analysis such as if I have in the patient diagnosis table the readmission rate, but in the patient demographic table, I have information on, gender or age, then I can see, who tends to be, grouped by age or grouped by gender, who tends to have higher readmission rates. And so this is how you can sort of sort through the data through writing SQL queries to really get an understanding of what your data is talking about. And here I'm showcasing the use of Power BI. So previously I was showing, writing SQL queries and sorting through your data. But of course, you cannot just show this messy raw data as your result when you're presenting to clinical stakeholders or to management. So you kind of want to summarize your insights in the form of a report or dashboard. And that can be used by using a tool such as Power BI or Tableau. So it's very important to document your steps, and that can be done through Power BI or Tableau. So just to kind of recap what I talked about, a typical day in the life can look like, having conversations with clinicians, really getting a sense of what the clinical problem is, then sorting through the data by writing SQL queries, then creating graphs and tables using Power BI, Excel, or Tableau, and then finally presenting your findings to clinical stakeholders and managers to get a sense of if what you have discovered matches what they think. And oftentimes this exists in a loop. So you'll present your findings, people will be amazed and shocked, and they'll want you to do even more analysis. And so it kind of exists through a loop until you're actually able to action on your analysis. So now I'm going to go into what are some job roles you can search for in this field today. Oftentimes I'll get this question from listeners of the podcast. What job should I be searching for? I don't even know where to start. And this makes a lot of sense because this field is relatively new and doesn't tend to have established titles such as, project manager or business analyst. Therefore, what I advise people to do is to search for a technical tool they might have expertise in, plus the word healthcare. For example, one could enter in Power BI plus healthcare into the search box of Indeed or LinkedIn. In addition, once you start searching enough, you'll start to see some common job titles they tend to have in them. So you'll often see many roles in the health informatics field have the title analyst. So I have a list here on the side: clinical systems analyst, EHR analyst, information systems analyst, clinical decision support analyst, or application analyst could be titles that exist within your region. So these are titles that you can search for in LinkedIn and Indeed and get a sense of some of the job requirements requested. Another tip I have is if you currently work in a clinical or healthcare organization, you might want to see if they have a business intelligence or clinical decision support department and look for the roles, the job titles within this department. And if you have a chance, try to job shadow for some of these roles. So you can either identify any technical skill gaps you might have that might be solved by taking a relevant course to improve your job application. And then I want to talk about how you can increase your chances of getting a job in this field. Although getting a job, can be equal parts timing and luck, sometimes just throwing your resume into the void of LinkedIn or Indeed can feel like you're not even moving the needle on your job application. Instead, I would suggest really beefing up your technical skills in tools such as Power BI, Tableau, Excel, and SQL by creating a portfolio project with a clinical lens to help develop and showcase your technical skills, especially if you already have a strong clinical background as a nurse or pharmacy technician. Creating a portfolio project can show to hiring managers that you have the necessary proficiency to hit the ground running when it comes to starting out in your job. So I've had the chance to review a lot of resumes from people looking to break into the field. And what I often see are people just listing technical tools that they have expertise in. So I just see, people will list under the technical skills section, Oracle, Power BI, SQL, but this doesn't really allow hiring managers or employers to see what is your proficiency with these skills. You could have, taken a one-day course in Power BI, or you could have 5 years of experience of Power BI. And, in this really competitive job market, hiring managers are looking at resumes, 10 seconds, 20 seconds. And if they don't have a good sense that you actually have an understanding of these technical tools, your resume might be pushed out. So that's why I always suggest creating a portfolio project, or if you're in school, doing an internship or a co-op to really showcase your skills, showing not just, telling, but really showing what you have done, to really showcase that you're competitive and really boost your application, especially in this competitive job market. So again, I've said here, creating your own clinical business intelligence portfolio project is key. So one of the major hurdles, and something that I found when I was trying to pivot into this field, is the lack of open source clinical data sets, which exist because, the risk of releasing personal health information publicly. Therefore, you can find tons of data analytical courses out there, through Coursera and Udemy using the popular Microsoft AdventureWorks data set. But it's much harder to find an analytical course with a clinical lens. And this is something that I struggled with when I first pivoted into this field. And therefore, I created an online course with a clinically focused data set, which again uses fake dummy data, which you could use to create your own portfolio project. I also walked through in detail how to write common SQL queries, and we walked through step by step on how you can build your own hospital KPI dashboard using Power BI. And then once you complete this course, you're able to showcase this dashboard with a unique link that can be embedded in a professional blog or hyperlinked in your resume for hiring managers to see the initiative you took to get that first role. And finally, completing this course will provide you an opportunity to speak to specific data cleansing methods you applied and the overall technical skills you have developed. So now I just want to end off the webinar with some quick tips on how to enhance your resume. As I said before, I had the opportunity to really go through and review several people's resumes who are interested in pivoting or breaking into this field. So some things that I've noticed that if you have a clinical background, I would definitely highlight this in your resume summary, and any technical skills you have gained through self-learning or taking courses, and vice versa. If you have a technical background and you're looking to pivot into this field, I would highlight any volunteer work that you've done at healthcare organizations, any additional courses that you've taken with a healthcare focus, and just really highlight these skills in your resume summary. Another thing that I've noticed when I was reviewing some resumes is that, especially with clinical individuals looking to pivot into the technical field, sometimes I would see that people forget to include the experience they have with EHR systems, such as Epic or Cerner, especially if they were in a super user role. So they had additional training on these systems and might have trained other clinical staff. This is really valuable to include on your resume, and I definitely suggest including that. And then earlier I talked about the clinical business intelligence portfolio. If you have no prior experience, be good to create a project which goes through the steps of solving a current healthcare issue. And this could be, readmission rates, patient satisfaction scores, things like this, using open source data sets and documenting the data cleansing steps, the statistical analysis and exploratory data analysis that you did to arrive to the conclusion of your project. And then visualizing that information using a tool such as Power BI or Tableau to summarize your end results. And then finally, linking to your work in your resume is a good way to stand out to employers. So thank you so much for your attention. You can reach out to me at healthanalyticsinsights@gmail.com if you have any specific questions. I also have a YouTube channel, Health Analytic Insights, and the podcast is linked here if you're interested. I have a lot of resources on breaking into health informatics, and I've interviewed quite a few people, so you'll get many different perspectives on this. Thank you so much.
Thanks, Alana. That was a lot of great information. And I see you have some questions in the chat. So if you want to go ahead and answer those, and if anyone has any other questions, go ahead and put them in the chat and we'll get those answered for you.
Sure. Catherine asks, can you please drop the name for learning visualization tools? So I will drop the name in the chat, Tableau, and then Microsoft Learn is where you can go to get the free modules. And then Regina asked, you mentioned downloading Power BI for free. Following that, you mentioned something about Google and I missed that. Please repeat your information. So what I mentioned was that you can go to Microsoft Learn and they have free modules for data visualization. So I'm just going to put that in the chat. And then interesting question from Vanessa. In a world where AI is increasingly the first person seeing your resume, do you have any tips to stand out? Are technical interviews common in this field like engineering? Very good question. I actually heard a really interesting tip yesterday on how to kind of use AI to update your resume. I haven't done it, but I'll just share it to see if it's relevant for people. So someone had suggested that you can search for, so I put a list of some of the job titles, like for example, clinical analyst. You can put that in LinkedIn or Indeed, and then take the job description and then put that into, get like 5 or 6 different job descriptions from different organizations, and then put that into ChatGPT and ask ChatGPT, what are the common skills? And then you can, kind of elaborate on that using your own past work experience or volunteering, whatever those common skills are, and it'd be like a good way to kind of update your resume tailored to job descriptions in the field. So I thought that was a really interesting use of ChatGPT. But yeah, I think in terms of standing out, what I said before about the portfolio project, like really showcasing that you have the skills, like how to build a Power BI report, even before, like they don't have to ask you about it like in the interview, but really linking to it on your resume, I think is a way to stand out. And our technical interviews common in a field. I haven't had technical interviews specifically for the health analytic roles. One of my friends recently had a interview and she had to basically talk about a portfolio project that she had done in the past using technical tools, but I've only had to do like coding interviews when I've done roles in like data analytics specifically. But it's more so talking about it, I found with health informatics interviews. So hopefully that answers your question, Vanessa. Jamie asked, do you have any recommended courses or ways to learn SQL? I'll just put a link. There's SQL Zoo. That's a resource I found helpful to learn SQL. It can be a bit difficult because I find that learning SQL can really help when you're on the job, because some of these websites are very like cookie cutter, very generic. But yeah, I find that, SQL Zoo is a pretty good resource. So I'll just put that in the chat. Shan asked, how to get job shadowing opportunities? Yeah, I would suggest either going to your department or on LinkedIn if you can connect with people in your organization and ask them directly if you have any ability to job shadow. That'll be very dependent on your organization. But I find that people are quite receptive, even if you can't like job shadow. I found that people are quite receptive to like coffee meetups. So I find that's another way to get a sense and understand of what are some of the skills or what are some of the roles that actually go on in a person's job. So you might want to also use LinkedIn for that. And then Jasmine asked, can you please add to the chat your email address and podcast link? Yes, I will do that. Then Steph said, I'm interested in IT healthcare. I'm currently working as a nurse. Do you recommend learning more AI in healthcare versus cybersecurity? That's a very good question. I found like, and this is like, from a Canadian perspective in terms of healthcare, so it might be different in the US if you're based in the US. But I found that AI has been quite slow to adopt in healthcare in Canada due to the regulatory issues. So I found that analytics is really what is being pushed right now with healthcare. And I think that, down the line, AI will be something that will definitely make a bigger impact. Of course, there are some healthcare algorithms, being used, but it's very, very few. And there's just a lot of regulation right now when it comes to AI in healthcare. So if you're, interested in right now looking for a job, I would kind of focus either cybersecurity or analytics. But then I definitely think, AI is going to have an impact. So, learning that I think it would be key. So hopefully that answers your question. That's just my perspective from, Canadian lens. NECA said, where exactly can we put the link of the portfolio project on the resume? And where can we build a portfolio project? Great question. So with the portfolio project that I was talking about, you actually build a Power BI dashboard. So once you've done that, when you publish to Power BI service, you have a specific link that's linked to the dashboard, and that URL, you can just put that in your resume. so I can drop some links at the end of the chat for that. And yeah, I'm not there's many different portfolio projects for free on YouTube. So you can build like a general analytics portfolio project, but I don't know of any clinical ones. That's why I specifically built that. But there are some on YouTube, like you can search up clinical portfolio project. I think Alex the Analyst is a YouTube channel, might be able to search for, and yeah, you can do that for free. Catherine said, are the job roles you mentioned in person, remote, or hybrid? So currently I work in a remote, but I'm going to hybrid next month. So I think the people who I've spoken to in the field, they are mainly hybrid, but it can really depend because, you know, depending on if you're working on with PHI, personal health information, your organization might want you to be on site. So it really depends on, you know, what directly the data that you're working with. So you could be remote, you could be in person, or you could be hybrid. I think it really depends on the data that you're working with. And then Taisha, hopefully I'm saying your name correct. Please correct me if I'm wrong. Was asking, will you share the recording? So I think that is correct, right, Gloria?
Yes, once we have it edited, we will send a copy of the recording out.
Okay, great. I'm just gonna put some of the links in the chat. And then she also suggested currently in school for bioinformatics. What type of informatics and internships or field should I explore? That's a good question. For bioinformatics, I don't know if you are based in, if you're based in the US or where you're based, but I would say potentially some healthcare government organizations tend to have quite a few internships. I know the CDC has a lot of internships, so I would definitely look at the government as a internship opportunity or co-op opportunity. Basically, any internship that can allow you to get expertise in like a technical tool, I found has been really helpful for people who are applying. Like if you can get anything with SAS or R or SQL or Tableau or Power BI, I really feel like that can help you to get a boost when it comes to applying for full-time jobs. So I would just try and find opportunities where you can really develop those skills. Betsy said, do you still recommend learning SQL and Tableau when pivoting from community engagement and current MPH student? From community engagement. So Betsy, if you correct me if I'm wrong, if I understand your question correctly. So you're saying that previously you're working in community engagement and now you're looking to pivot into like a tech-based role? If
Yeah.
so, okay, great. Yeah. If so, yes, I would definitely suggest recommending learning SQL and Tableau. And also I would definitely highlight, because community engagement, you have a lot of skills from that, you know, when it comes to communicating with stakeholders. And as I was saying previously in the presentation, communication skills is key for this role. So I would just say, don't forget the skills that you've learned in as a MPH student in terms of community engagement. Those are very key skills also in this field. DW asked, is there any advantage to obtaining a degree in this field if you're already established in a career versus self-learning? Getting a degree in this field, is it really possible to break into via self-learning? I'm currently a hospital-based clinician. Okay. Yeah, that's a good question. I would potentially, just from my own perspective, I would try and see if you can pivot because you already work in a hospital. I would try and see if, they have a clinical decision support department or business intelligence department. I don't know if I would necessarily go and get a degree, that's like a life choice, like based on your time, financial resources and things like that. But I would try personally if I could pivot with the skills that I already have and the connections and networking to see if that's an option. And if not, then I would get the degree. But I would try and do self-learning first and, network with people. That would just be my path or suggestion. But to each their own, because I feel like sometimes when it comes to some of the degree programs, and I've spoken to people, sometimes I find some degrees can be very like theoretical and like I know in engineering, we learn things like MATLAB, and that's not something that's really highly used like within the workforce. So I think that sometimes there can be a disconnect between some of the tools that you learn within your degree and versus what's actually being used in the workforce. So I would suggest, first trying to do the self-learning route, and then if that's not an option, then I would get a degree, but I would try self-learning first. Taisha said, I was thinking about imaging informatics, but unsure how to look for internships in that field. That's a good question. I can share a internship guide that I was recently looking at, which has many different organizations that have internships. But yeah, I usually would just go on like Indeed or LinkedIn and just kind of look at like imaging informatics internships and kind of see which companies pop up. But yeah, I will share the guide in the chat. Just 1 second. I could ask, who did you say we should look up on YouTube, look more into building healthcare portfolio project? So I don't know if anyone who's doing specifically the clinical portfolio project, but people who are doing just the general data analytics portfolio project is Alex the analyst. So I'll put his name in the chat. Nessa said, yeah, mine was theoretical. Now I'm taking a cert program elsewhere. Yeah, that's a really good point, Vanessa. Maybe like the certificate programs are more like hard skills. Yeah, that's another option, like taking a certificate program. Yeah. So I'm just going to post the public health guide. I just posted the guide. I'm not seeing any more questions. Should we wrap up, Gloria, or what do you think?
Yeah, if we've answered everyone's questions, yeah, we can go ahead and wrap. Does anyone have anything else that they want to ask? Oh, we have one more question that came in.
I've seen some job postings prefer programming language between SAS, R, and Python, which I've used the most. So for me, I've used R the most. Previously in my organization, SAS was really highly used, but I think they're getting rid of it just because R and Python are open source. I personally think now that Python is now being integrated into Excel, that's going to be the tool that's going to emerge successful. So personally, I would lean towards learning Python. That's just my own opinion, because I think Excel is something that will be used to the end of time. So I think the fact that Python is now being integrated in Excel is like a sign. Yeah, for sure, NECA. I'll just put my email in the chat again.
Okay. Anyone have any other questions? This was great information, incredibly helpful, and I'm sure opened everybody's eyes to some real possibilities. Thank you so much, Alana. I'm so glad we got a chance to have you on and have you share with everyone, whether they were here with us this evening or, whether they'll get a chance to see the recording. We really, really appreciate you being a part of this.
Thank you. Thank you so much for this opportunity.
Somebody's been watching your YouTube page.
It's great. Thank
That's
you.
fantastic. And thank you everyone for coming and joining us this evening. We really appreciate it. Watch your email. We will send you a follow-up email that will have information about the recording. Give us a couple days so we can get the editing done, and we'll get that out to you. And it will also have information about our spring summit coming up on May 2nd and 3rd with that discount code that I mentioned. So everyone have a really, really lovely evening, and we'll see you at our next event. We do have another virtual event coming up on February 29th, and it is about protecting your personal information in the age of AI. So some more great information that I'm sure you are not going to want to miss. So make sure you check out our Eventbrite page and register for that one as well. So thanks, everyone. Thanks for joining us this evening.
Bye. Thank you.